And Moulton is closing some of its departments because they just aren't making enough money. And today, hospital officials tell us about those changes. Lawrence Medical Center is partnering with Huntsville Hospital to revitalize its outpatient care, which makes up the vast majority of the hospital's operations. But people will have to go to Decatur or other nearby hospitals for emergency care. Fox 54's Caleb Aguayo was in Moulton to see what's in motion.
Lawrence Medical Center in Moulton is closing its emergency room and inpatient care, which takes away emergency services like dealing with heart attacks or strokes, respiratory failure, broken bones, and longer-term care.
This is the only facility in this county, medical facility, to treat people. And I think it will be a hardship, especially for elderly people, to try to get to another city for treatment. I also think that we need to keep this facility here because of emergencies and that kind of thing.
It's because the rural hospital doesn't have the funding to keep those services open. The board of directors voted to close those departments because they only make up about 5% of the hospital's operations, seeing around 10 to 20 patients a day between the two departments. Interim CEO Kim Robertson says it was a difficult decision, but the alternative was to shut the hospital down entirely.
The expenses were a lot more than the revenue that we brought in. And due to the low census, we just don't have that. We have a low volume in those areas and also a low reimbursement from our payers. And we just can't make it with that anymore.
The new agreement is set to help the hospital here in Moulton to bring in revenue. Like other rural Alabama hospitals, it's been struggling due to low revenue and high costs to operate. Hospital staff tell me that urgent care in town will see some ER patients, but the rest will have to go to Decatur or another nearby city to get seen.
There's no way to sugarcoat that. It's difficult to lose the emergency department in the community. However, the vast majority of the care the hospital delivers, including most of what they do in the hospital building, is outpatient care. Well over 95% of what they do is outpatient care that we intend to move to a new modern location.
The Huntsville Hospital Health System will be working with the one in Moulton to revitalize outpatient care in the county. That will mean building a more modern hospital and reinvesting any profits back into the Lawrence Medical Center for minor, shorter-term care. In Moulton, I'm Caleb Aguayo, Fox 54 News.